to the Galen podcast, episode 2, Mental Health Matters, Changing the Conversation in Belize. That's a conversation that we have to have, right? My name is Janine Cayetano, and I'm your host for today. And we have with us Miss Ganesha Smith, and we have Dr. Kendra Flores Carter. And before we jump into the meat of this podcast, I wanted to ask both of you to share with me, how are you showing up today? How are you feeling? And I definitely don't want to hear good or bad, but I want you to dig a little bit deep. How are you showing up today, especially given the topic that we're going to be talking about? Anybody can go first.
I'm showing up. I think I'm definitely uncertain. I would say that's the word, uncertain, only because of the time and space that we're living in. I am a born Belizean, but I live abroad in California, and we have a lot going on here right now. We have elections on Tuesday, and there is a lot of things happening as far as our local cities and national, and of course, you probably know federal as well. And so there's definitely some uncertainty that I feel like I am feeling in regards to what's happening and what's going on. And I'm sure that a lot of folks are along the same lines as I am, in that same boat, feeling like what's going to be the next big thing, because every day seems to be something. So, yeah, that's where I am.
Thank you for sharing that with us, Dr. Flo Carter. Ganesha?
I am showing up feeling really good. I know you said you don't want to hear the word good. I think I'm happy. I'm at peace. I'm going through a transition in terms of work. And of course, there is growing pains. And so that's my experience, and that's where I am right now.
Thank you both for sharing. We know how important it is for us to get certain things off our chest or express them. So I want to say thank you for that, and thank you very much for taking the time out of your busy schedule to join us today. So I want us to start by you both sharing with me a bit about yourself and what brought you into mental health or advocacy work.
I can say that I am an associate professor at California Baptist University in Riverside, California. I recently got tenured, which is really a coveted, accolade and promotion. So I'm really happy about that. I'm also a published author. I have written 2 textbooks. Medical social work practice is one of them. And just recently in 2024, published a second text called Infusing Social Justice into Social Science Practice. And so, I'm a writer, I can say that. And I am also a researcher, big on scholarship as it relates to maternal and child health. Currently involved in a study where we're looking at perinatal loss and looking at the experiences of perinatal loss. Most recently, about a year ago, we completed a survey where we looked at maternal health experiences. So a lot of the research that I do is around women's health and women's well-being, families' health, families' well-being as it relates to childbearing and pregnancy. But I do have other interests. I would love to explore, other things like mental health. And I've always wanted to look at the attitudes towards seeking mental health treatment. That was really the basis of my doctoral work, was looking at attitudes. And so it'd be really amazing to be able to expand that work. So I do have a background in looking at research in mental health as well. So yeah, I'm a mom of 3, married to a Belizean man, and I love coming back to Belize whenever I can. So that is who I am. So, yeah.
That's a big person. You have a lot on your plate, and I hope to read your book one day. Ganesha?
Definitely great to hear all about you, Dr. Carter. I definitely would look for your books to see, for me to read those. I am a social worker by profession. I've been in the social work field for the past 25 years. I have worked from working within the truancy unit to working within child protection unit, and currently working with juveniles, delinquent juveniles who have either been deemed as beyond parental control or who have came in conflict with the law. I enjoy being a social worker. My passion is working with children and young people in meeting their needs and exploring the possibilities for them as they grow. Spending 19 years within the child protection unit or the child protection system has definitely enhanced my vision of the direction I would want to go career-wise. It's to see the potential in young people despite adversities, mental illness, and every other thing that comes in between for them. And so when I crossed over to working with juveniles, I saw a different angle of young people, from an angle that is not much looked at or paid attention to by society, because they're deemed troublemakers and persons who don't want anything. And that's not it. And so as an advocate, I think that mental health, or looking at the issue of mental health, changing the conversation of mental health, is definitely one that is there to me, because you have to dig deeper. Like you said, in terms of telling us who you are and how you came today, it is to find out how did persons get where they are, and what the support system looks like. And so that is who I am. I am just a passionate person for social issues, primarily working with young persons. That's me.
Thank you. Thank you both. I'm honored to sit in a room with women with such extensive experience in this field. And when we look at the title today, Mental Health Matters, Changing the Conversation in Belize, why do you think that we have to have this conversation? Why do you think that this conversation is needed and it has to happen?
Honestly, I think we have several reasons why. The world is different today. I remember growing up in Belize. I migrated to the US when I was 14. So I was old enough to kind of have some lived experience in Belize. And I remember having an aunt who suffered from mental health, and it was just like, it was so hidden. I didn't know that she had a mental illness until years later, after I came here to the US. And I was around, I think, 17, 18, when my mom finally kind of revealed to me that, she had a mental illness, because I didn't know. Growing up, it was never something that was ever spoken on or talked about. It's almost as if there was a stigma and like shame connected to her suffering. And when I found out about that, I think it messed with me emotionally and mentally, because then I was able to put myself in my aunt's shoe, and just someone who was suffering and someone who was struggling, and having the entire society look at you differently and judge you in a way as if you were a throwaway, or you weren't good enough, right? Because you had a mental health issue. I've learned over the years, studying mental health and studying, this field, that honestly, 1 in 5 people will experience some sort of mental health crisis in their lifetime. So it's more of us today that's suffering from a mental health issue. Some of us know how to function well with depression. Like we do. We function well. We get up every day. We do what we have to do. But then we suffer in silence, right? When it's like, oh my goodness. So I think that is the reason why mental health is important, and it's important for us to address it. Because 1 in 5 human beings walking around are probably in suffrage from some sort of mental health crises or issues. And they're just going about their day every day in silence, knowing that something isn't right, right? And we've learned to really live in this mental health struggle, which to me, it's more of a burden to live with constant anxiety and constant depression, where we can normalize getting help, right? Just like we normalize getting help for physical ailments, right? I have the flu, I have a cold, I have a cough, I'm going to the doctor. If I'm not emotionally doing well, why am I not saying it's okay for me to go talk to someone, right? And so I think that's one of the reasons for me why it's very, very important.
Thank you. And I share similar experience in finding out as an adult that I had an aunt who has experience with schizophrenia and eventually passed away. So it's very important for us to have this type of conversation, because we're going to find ourselves in a position where we are adults and we're just finding out these things. So the earlier we're able to have this conversation, whether we start from childhood and push all the way into adulthood, it's important. So Ganesha, what are your perspective?
I definitely think the conversation has to change. I too have family members who have been diagnosed with mental illness. I've worked with children who have been diagnosed with mental illness. And because of ignorance, persons don't know how to interact or respond to them. And I've seen where people use violence, people use isolation, people become very shameful of identifying or even saying that this is my relative, this is my cousin, because of the stigma that will come behind it. We definitely are in an era that we are seeing a lot more mental health issues. And if persons are not informed of what mental health is, because oftentimes you would hear in Belize, mental health is associated with the people who are walking around the streets. And it's beyond those people walking around the streets. And so it's to inform persons that, you know what, it's about a feeling, it's about experiences, it's about more than just the surface, but psychological issues. And they need to understand what that looks like. Failing, not knowing that, then we become very judgmental. We block out people, we disregard them, and the situation kind of just escalates. And I see that a lot working with children, where you would see parents would say, and I might break into Creole a little bit, ladies, but you would see parents say, nothing wrong with her. He good. He just want to give trouble. But there may be a lot more underlying issues to this child's behavior that parents don't understand. So they can't see it. And if they don't understand, they can't connect it to something bigger than the child just wanting to act out. So the conversation definitely has to change in order for us to address the issues from young, because it's not only the adults we're seeing right now, you know. We are seeing a lot of mental health issues manifesting through our children. And if we don't address it from then, the situation will just become more compounded and complex. So it has to change.
I'm glad you brought that up, because when we look into our community, when we look into the people we interact with, and we as professionals in this type of profession, and we find ourselves talking about counseling, we find ourselves talking about mental health. Because people don't understand what these things are, what counseling is, it kind of impacts their understanding of the process. And so I want to know, when you're talking with your community about counseling or mental health, what are usually the reactions that you get? Because for me, when I'm working in the field, usually when you speak to people about counseling, one, they don't know what it is. They think that you go into the session and all you do is talk, right? You get things off your chest, or they immediately say, I know, crazy. So when you talk about mental health, when you talk about counseling with people, with your community, what is usually the reactions that you get?
I think that it also depends to what community and like the age range. What I find now with our Gen Zers and our Gen Alphas, I think the culture towards mental health is shifting. If you guys could recall Simone Biles, the gymnast who said I wasn't going to go to training, I wasn't going to go to competition because I needed to take care of my mental health. I think that was a big step when she did that, because I think her being probably a part of this Generation Z, right? And encouraging of, hey guys, we need to take care of our mental health, really did shift a lot. As a parent myself, I remember my kids growing up, and initially when the school used to, they have school counselors out here. You know, all of our schools pretty much have someone in the school to kind of like buffer kids that might be going through things at the school. They used to always send me letters saying, hey, do you want your kids to talk to someone at school? And I used to always decline. But I don't know what switch. I think there was some bullying going on at one point with one of my child. And I was like, you know, let me say yes. And I said yes. And the 360 that my daughter made was amazing. And I was like, you know what? This is not a bad thing. I mean, she doesn't have any mental health issues or anything. And there was just a little bit of bullying and she needed to process that. And she began to see the counselor, and a lot of things shifted for her. And it was things that she could talk to that person about that she couldn't talk to me about. And I realized as a parent then, you know what, even if they don't really need to go, I'm going to sign them up anyway. Because you never know when they might need to go talk to the counselor about whatever. And so that has been my motto. It completely switched because I saw the work that that school counselor did with my daughter. And I saw just how she brought out her, you know, her love for art, you know, and, you know, they did a lot of little things together. And she discovered a lot of things about herself that I don't think she probably would have if she didn't have time to talk to somebody about it. And so, you know, our children sometimes, or even our family members or loved ones, they can't always talk to us. And that's how I approach it. Whenever I talk to anyone about counseling, I'm like, you know, you can't tell me everything. And I know that certain things you want to keep to yourself. A counselor is like a mediator. It's someone in between. And I even sometimes refrain from the term counseling and just say like a coach that can help guide you in life. You know, you might have a question about, you know, you can adjust to this or adjust to that, and you just need someone to guide you towards the goal, right? To help you score that goal. And that coach, that mental wellness coach, can help take you there so you can score that goal, right? And so I try to introduce mental health counseling and just being involved with any type of therapy in a way where it's something to kind of help enhance who you are as a person. It's not something that's going to take away from you. It's something that's going to add to you, who you are, right? Because we all have different lived experiences. And some of us are able to deal with those obstacles head on. And some of us have some challenges, and that's okay. You know, what challenges us in our life might not be the same for another person. And so we really need to accept that and know that there is help in going and that you can get better if you seek that help, right? From someone who is an expert at it. So yeah, that's pretty much what I tell them.
Thank you. And you can see how your own reaction changed eventually, right? So thank you. Ganesha, how about you? When you talk about mental health or counseling to somebody or the persons that you work with within your population, what is usually their reaction?
I think, like Dr. Carter, the mindset has shifted. There's definitely a long road ahead of us. But what I used to see was persons saying, oh, that's for crazy people. Nothing wrong with me. And again, for me, that comes from not understanding your own emotions and feeling. What is depression? What is anxiety? What is a panic attack? People don't understand what those words mean. And so as a result, they don't associate it with counseling, with mental health. For me, I grew up in a family where it's always important to say how you feel. We have a very open family. And so everybody would check in. How are you feeling today? How are you doing? And I have two daughters, and they have, I wouldn't want to say habit, but they have developed that same mentality. I have a younger daughter who is studying medicine, but is asking me if she made the right decision. The reason for that is because she is seen as the person that everybody goes to just to release, just because she's an active listener. She pays attention to body language and things that are being said. And so that's why I agree in terms of our Gen Z generation. They are becoming more open to discussing their emotions, how they feel about certain things. But I can tell you an experience I had with my own family that allowed me to informed or raised awareness was, without identifying who those persons are, an older family member was refusing to admit that something was wrong with a cousin of mine. And it didn't matter how we tried to say to her, you know what, something is wrong. He needs help. He needs help. She could not see it. And I had to find myself just breaking it down as simple as possible, telling her about the behavior. You see him doing this? This isn't normal. Do you see him doing this? He's isolating himself. He talks about killing. He doesn't express his feelings. He doesn't have friends. He doesn't know how to socialize. Something is wrong. And then I kind of ask her to tell me about you. You laugh and talk with everybody. You smile every day. You communicate with your neighbors. He doesn't do that. So do you think that that is normal? And that was my way of getting to her to say, you know what? Okay, whatever counseling is. Again, because of ignorance, she didn't know what that meant. But she said, whatever counseling is, you could take him. And we were able to work with him. He was diagnosed with a mental illness. And he started to receive the services that he needed. But all of it comes to ignorance. And I find myself in my community, before even offering persons to make necessary referrals, I have to go back to basic and tell them what it is. What does that mean? To say that it doesn't mean that you're crazy. It's not taking away anything from who you are, but it's putting you in a better place to function and to cope with whatever it is that you're experiencing. So I have to do all of that first to get buy-in for persons to say, you know what, hey, I need the help.
Good. So you find that you have to empower through education.
Have to, definitely.
Thank you, both ladies. We know that the reactions today, especially among Gen Z, is definitely changing. And they are talking about their feelings and experience much more. And they're also seeking help. What do you think? Why do you think that there are so many people still see mental health as something to hide or to feel ashamed about? I have my dad who is still alive, right? And I lost my mom about 13 years ago. And it took my dad, he's 66 right now. It took him 11 years to say, I was depressed, right? This is what I was going through. And this is a man who is very much stick to tradition. And it took him, he lived with that experience, that feeling for over 11 years, right? And he hid that. So why do you think that there's still many people who see mental health as something to hide or feel ashamed about?
I think it's just we have learned to live with the pain and the trauma. It's intergenerational, right? The cycle is cyclical. Like mental health goes back way, way back, and we have learned to just suffer in silence because we saw our grandmother, our great grandmothers, our mother. And so when it comes to us, okay, well, they got through it. So we just got to push through, in maternal mental health, we talk about this complex, a superwoman complex, right? That's sojourner truth syndrome, where you got to push through the pain. And so we've really learned to live with that trauma of just pushing through. And so we do everything through that trauma lens, like, okay, yeah, I don't feel well today, but I still got to go and do what I got to do, even though, I feel like I'm breaking apart or everything is falling to pieces, but I still have to show up instead of saying to myself, you know what, I need to take care of me, because at some point I'm going to be overwhelmed and I'm going to burst. And when you burst, you end up in the hospital. We have learned to live with so much trauma and so much pain and so much mental health issues that it then manifests into high blood pressure. It manifests into having diabetes because we're eating our feelings and we're eating all the wrong things, right? And so a lot of the mental health that people go through, what you don't know is the more that you stuff it down, the more that you don't address it, the more it begins to eventually physically manifest into a medical condition. They say stress kills. Stress really does kill, right? We deal with stress day in, day out, every single day. Eventually, you're going to get that stroke or heart attack. And, it will be like, oh, that's what happened. But that's what had been building up over years of you not taking care of yourself mentally, right? And I think there's a huge lack of education still as to how mental health illnesses manifest into physical ailments. And if we don't address it, we'll end up in the hospital at some point.
What about you, Ganesha? Why do you think people see mental health as something to hide or to feel ashamed about?
I think culture has a lot to do with it. And I think culture within different households or societal cultures. We were brought up in a home that men are not to cry. We were brought up in a home where strong people don't cry. We were brought up in a society that you don't tell everybody your business. And so as a result of that, people don't seek help. People don't talk when they're hurting, when something is bothering them, when they have an issue that they cannot address or solve themselves. People don't talk. And that creates a lot of it. Persons are ashamed. They fear being judged because we have and I do again see change with this new generation, but we have a very judgmental society that the minute you say something, people start talking about you, people start assuming things, which makes it difficult, or it doesn't make it easy for you to seek help. And so as a result of that, people then begin to suffer psychologically and physically because they're not using the outlets just because of what they fear, the unknown, and that's worrying for me, because when I see a lot of young people displaying behaviors, and you would try to just have a chit chat. For them, the vocabulary is very limited. I'm good. I all right, miss. Tomorrow will be a better day. But they're not processing that there's a bigger picture behind it. They might not even remember that some of the trauma that they have experienced years ago is as a result, because they're not connecting and they're just living right now. I want to solve it today. I want to figure it out. Miss, I might sleep it off and get up tomorrow and hope tomorrow is another day, not thinking that the problem will escalate again. And so, again, I think this is why the conversation has to change, because mental health exists. It existed before we knew what it was, the different diagnosis, and it will continue to exist. But if it is that it's not being looked at and paid or given the attention, then we will continue to see more of this growing more faster than we think.
Thank you. And I'm glad you brought up the topic about culture. We know that within our own families, that's the first stage of socialization, right? I had a sister who once told me not to cry because that is weakness, and you'll just have to toughen it up, right? And so we know that in some families, emotions and showing your feeling are seen as a private experience. So, or even shameful for some. Don't tell people about your business. You shouldn't talk about what you're going through. That should be kept in the home privately. So my question is, how can we begin breaking that silence? How can we begin telling people that it is okay to share these things? It is okay to not carry these weights and these burdens by yourself. Here's some. Help me manage. So how can we begin breaking that silence?
I do believe that education is the key. The more people know about the importance of seeking help, the more that they will understand, hey, this is not okay for me to continue to live like this, right? And I honestly live by example. Like, I have been to counseling, like I have, and it was a time where I graduated, I believe, from college, and I was figuring out my own independence. And that was a struggle for me, I was adjusting to life and figuring out having a job. All of a sudden, I'm no longer under my parents' guidance, and I had this job, and I have to be responsible, and I have to, figure it out every day. And it was tough. It was like a wake-up call to no longer be having your parents do everything for you. That was tough for me. And so adjusting to that was important. It was a challenge. And so, I went to my doctor for my physical, and he was like, do you want to talk to the social worker? And I'm like, yeah, sure, why not? And I did. And it made me feel better. I just processed everything, and I cried about, having to figure out my life now. And, I can't go and call my mom and, and tell her I need money. I have to pay my own rent. And those things are hard to do as a young person. And so in life, you have adjustment, whether or not you just got newly divorced, and you need to process a marriage that have ended. Like, you probably do need to go talk to somebody about that, because your life has shifted. If you just lost a spouse, your life has shifted as you have known it. That's trauma. It's traumatic to go through a loss of any kind, whether it's death, whether it's marriage, whether it's a relationship, and having to carry that burden alone can be a lot. And I find just talking, like, some people say, oh, I don't want to take medicine. I don't want to do it. You don't have to take medicine. Not everyone needs medication management when they're having a mental health issue, right? And I think that's also another thing that maybe heightened the stigma is like, oh, they're going to put me on pills and I'm going to be like a zombie. No, that's not what that is. Sometimes you just need to talk to someone. You just need to process through and talk through your feelings rather than hold it all in, right? Life is tough, especially today, right? Today with social media and all of the extra things. I deal a lot in maternal mental health. So a lot of the patients and people that I talk to have suffered postpartum depression. And part of that is them seeing all of these women bouncing back and having these beautiful bodies after they've given birth like 6 weeks. And they're like comparing themselves to other women. And it's making them sadder and sadder because they're not there yet. So teaching people to accept where they're at will definitely help in breaking that stigma and in living by example and really being honest about your experience. My lived experience is, yes, I have talked to a counselor before because I needed to figure out my life. And it helped tremendously, right? Just to talk it through. Talking it through was really eye-opening. And you know what? It was helpful. So, you know, if people want to say, oh, you crazy, then you know what? If crazy looks this good, then I'm going to be crazy all the time because, you know, I'm walking in a path where God has blessed me to achieve a lot of the things that I have achieved in my life. And, you know, being able to have somebody to talk to about that and process these things was important during that time and space of my life. So at the end of the day, I think also living by example. And I encourage my children, like, if they're going through a crisis or something, I'm going to be like, do you want to go talk to the counselor? Like, I am quick to say, because it's a part of now my culture in my home. Like, I'm okay with saying, hey, kids, like, if you need to go, I'm living that. Like, let me know. Let mommy know if you want to talk to someone, and I will make that appointment for you, right? Because I'm living that every day. And I think when we shift that, it's important. It's important to be able to process through. And finally, I just want to say, even if like it's like you've been newly diagnosed with a medical condition, you know, that is important too. You got to process through that. You know, my background is in medical social work, and every patient with a new terminal diagnosis had to see a social worker. Every patient that the doctor said, hey, you're not going to make it past the next 6 months, had to see a social worker. Like, you know, you're newly diagnosed with HIV, you had to see a social worker. These are things when you intertwine it into the culture, when you intertwine it into just everything that you do, then it makes a difference. And I think maybe adjusting the way that we see things and look at things in Belize can also be very helpful, right? How are we supporting people who might need some mental health support, right? How are we intertwining this education, intertwining this counseling into what it is that they might need? So yeah, that was long, sorry.
Thank you. And for us to wrap up, what does a stigma-free Belize look like to you? Maybe Ganesha can take this one. What does a stigma-free Belize look like to you? Thank you, Dr. Carter.
I think stigma-free is a lot of awareness. I think that we need to put information out there for persons to access. And it has to be from various points. We need to have information for adults. We need to have information for children. We need to have information in the different languages. We need to provide space where persons can openly say, I am not okay, without being judged or even thought anything or treated differently. I can come to work and say, you know what? I am not okay today. Can I get some time? I could have my child come home to say, Mom, I am not okay. can I get a day off? And it's things that we look at, pay attention to daily. Simple routine, checking in would help to create a stigma-free environment. One of the things I just wanted to add is that there are two different forms. There is the visible form and there is the invisible one. And so when you would see behaviors of persons having these panic attacks, anxiety attack, isolating in themselves, those are things that we can see and maybe can pinpoint and say something is wrong. But then what happened to the ones that we are not seeing? The ones that are not diagnosed, persons with bipolar disorder, and we see them one way in a minute and another way. Persons just not communicating. Those are things that we are not paying attention to. In order for us, again, to go back to stigma-free, we have to know what these things are. We have to know it. And it starts with us as social workers, as advocates in whatever medium or area that you work, to kind of spread that word and encourage that. So it means that it starts with me. For me as an advocate, to say that I have gone to counseling. For me to say that I have gone because I was having a stressful time with a particular situation and it worked for me, helped people to identify and associate some of their feelings and some of their emotions. And that kind of allows us to open up and become a little bit more comfortable with each other and willing to share and seek the help that we need.
Thank you very much. I want to express my sincere gratitude to you ladies for joining us today. The conversation is important and I hope that we could continue. I wish we could continue, but for now, we're going to keep this in mind. We're going to do the work like Ms. Smith mentioned. It starts with you, it starts with us. And we want to continue to share the word about why mental health matters and why it's important to change the narrative or the conversation. Thank you very much for joining us.
But Ms. Janine, I just want to end with one particular quote, and this is for me, and I definitely will want to share it. It says, healing begins the moment we stop pretending to be fine and allow ourselves to be human. When that happens, we open the door for all different sorts of help for us to function in whatever capacity that we need to. So it starts when we stop pretending, and it's okay to say, I am not okay.
Thank you very much, ladies.